going from where I left off, my camera shut off. I'm going to go ahead and put my finger in and let baby suck. Again, feeling the top of the mouth, the roof of the mouth, feeling those palates, making sure everything's intact, there's no cleft lip, anything like that. So now we're going to go to the neck. We're going to make sure that the neck is mobile. I can do this by gently turning baby's head, just making sure that the neck moves properly. I'm also going to make sure that the neck is midline and the head is all centered. I'm also going to be feeling for the clavicles, making sure that they're intact. And then I'm going to be looking for any webbing along the neck, and I don't see any here. For the chest, I'm going to look at the chest shape, see if it's concaved or if it's round. I can also see if this chest is symmetrical. I'm going to be looking for breast buds and nipples, making sure that there are only 2. I'm also going to be looking at the lung sounds, and so I'll be auscultating that. There are only 3 regions on each side when listening to a newborn. I'll make sure. And again, this is clean with the alcohol swab. So starting on the right side, I'm going to be auscultating the 2 upper lobes. And I'm just looking for even unlabored breathing. I'm going to the left side, comparing them, seeing if there's any gurgling, crackling sounds, rattling noises. I'm looking for clear breath sounds. The other part of the upper lobe, comparing that to the other side. And then the lower lobe is going to be kind of located down here at the side. And if possible, I want to try to do my auscultation as early as possible in my assessment, just in case baby starts to get a little agitated and starts crying towards the end, because that can make it difficult to auscultate the lungs and the heart sounds. Now I want to go to the heart since I'm here. Starting with the diaphragm of my stethoscope, I'm going to go to the aortic valve, looking for S1 and S2. And then to the pulmonic valve, again, S1 and S2. At the tricuspid, you can use either the diaphragm or the bell of your stethoscope. I'm going to use my diaphragm. Again, S1, S2. And then I'm going to go down to the mitral, and I'm going to actually switch it up to the bell for this. And again, looking for S1 and S2. And any additional sounds that I hear or any murmurs should be recorded. I'm going to take a listen to the apical pulse, and that's located down here below the 5th intercostal space, midclavicular. And I'm going to be counting that. The baby's heartbeat is pretty fast. It should be between 110 to 160 beats per minute. So I'll be listening to that. I'm also at this point going to see that the maximum impulse is right here at the apex, and see if that apical impulse is visible or not. Going down to the abdomen, I'm going to assess the shape of this, see if it's rounded, see if it looks swollen, anything like that. And then I'm going to listen to the bowel sound starting in the right lower quadrant using the diaphragm of my stethoscope. So right lower quadrant, bowel sounds present. I'm going to go up to the right upper quadrant, bowel sounds present. Left upper quadrant, bowel sounds present. Left lower quadrant, bowel sounds present. So bowel sounds were present in all 4 quadrants. I'm going to be looking at the extremities, making sure that they are symmetrical. Looking at the feet, making sure that they're symmetrical. I'm also going to be looking for movement throughout this exam. So this is a doll, but baby might be kind of, every now and then. So I can see how frequent those movements are. What are they moving? Are they moving their legs, their arms, all 4, whatever it is. I'm going to be counting the fingers and toes, making sure there's 5 on each hand, 5 on each foot, 10, 10. I'm also going to be checking for hip dysplasia, so I can do so by doing Boslow and Ortolani's. So when I do, I'm sorry, did I misspeak? I'm going to be doing, the hip dysplasia. So the first movement is I'm bringing the knees to the chest like this, and this is going to be called Ortolani. And then now I'm going to be doing Barlow, and so that's when you're going to gently open the hips. And what you're doing when you do these assessments is you're looking for clicking. And so if the clicking is present, hip dysplasia may be present. So some other reflexes I can do are the palmar reflex. So that's where I'm going to put my finger in baby's hand, see if they wrap their fingers around mine. And then I'm going to do the same thing with the foot and look for those toes to curl around mine. I'm looking for them, make sure that there are no simian creases on the baby and that both the brachial and the femoral pulses are all present. In my case, I have a baby girl, so when looking at the genitals, I'm going to make sure that the labia majora cover the labia minora and that there is a clitoris present. For discharge, with newborn baby girls, we can see either clear discharge that looks similar to egg whites, or we can see a little bit of blood in the discharge. And both are normal because babies can bleed sometimes in their vaginally due to the mother's hormones, but that should stop very soon after delivery. So now we're going to go ahead and turn baby over using safe handling methods, making sure we support that neck. And we're going to be going ahead and looking at the spine, making sure spine is intact. It's all nice and straight. Another thing we can look for at the end here, around the sacral region, and making sure we don't have any dimple or any hair tuft here, because those can be indications of spina bifida. We're going to be looking at these gluteal creases and making sure that they're equal on both sides, as well as the leg creases, making sure everything is symmetrical. We're going to be looking for some lanugo that can be on the back of the ears, on the shoulders, and on the arms here, even the back of the neck. A small amount is normal. The less you have, the greater the gestational age may be. So this baby has a little bit, but that will fall out soon. Totally normal. Another thing we can look at is if this baby has Mongolian spots. Mongolian spots are mostly seen in Hispanic and Black babies. This is a Caucasian baby right here, and she does not have any Mongolian spots. However, if she did, it would be perfectly normal and they would go away on their own as well. Looking at the skin, I'm going to see the color. Is it pink? Is it blue? Is there peeling? Is there dryness? We're looking for things like that. Is the skin intact? Are there any cuts or injuries, from delivery or from forceps on the head we're looking at especially. I'm also going to be looking for the blue color, the acrocyanosis, especially in the limbs and the toes and the fingers. Some other things we're looking for is café au lait spots. I do see that my baby has some on her chest. This is perfectly normal. These will again go away on their own as well. I'm also looking for nevus flammeus, which is also known as port wine spots. These are not present in this baby. Another thing I can look for is erythema toxicum, which is just a rash that, again, will go away in a little while, and it's nothing really to worry about. Oftentimes, when the baby has a rash or milia, nothing needs to be applied, and it will actually just go away on its own. Should not be treated like normal adult rashes or acne. Some reflexes that we can do are, I'm going to start with the moro. So the moro is either startling the baby by clapping above its head or kind of giving it a slight drop, whatever you're comfortable with. So you can kind of go like that or clap right here. See if baby's flailing their arms and legs. That would be a positive and a good result of that reflex. We're also going to be looking for Babinski's reflex, which is where you can draw a line kind of down the sole of the foot. Then you're going to look for the toes to kind of fan out and then crunch in. You want a positive for this reflex. However, if this is seen on adults or absent in the newborn, this can both indicate neurological defects. And then the last one I want to do again is just the grasp, both the palmar and the plantar. So just placing the finger and making sure that the toes and the fingers curl around it. Some indicators of this baby's gestational age can indicate both their weight and their length. And so these can both be charted and seen on a line graph to see where they fall. Another indication can be their amount of lanugo. This baby only had very little, and so I can tell that she is of a good gestational age. Other things that we can use to see the baby's age are the reflexes. So this baby had all reflexes present, so that tells me that they're of proper gestational age. And then another thing that we can use to indicate this is to see if the all genital structures are present, and also we want to look and see if that the anus is patent as well. And so yeah, again, this assessment is done to detect any abnormalities that we can assess, and at this point I would make sure I remove my glove, I wash my hands again, I sanitize my equipment again, I swaddle baby back up, and I return her to mother.